Hello class, my name is Andrea Ramirez and my medical terminology presentation topic is cirrhosis. The topics I will be discussing are what is cirrhosis, what causes cirrhosis of the liver, symptoms of cirrhosis, stages and signs, how is it diagnosed, and what is the treatment and prevention for cirrhosis. So let's begin. The prefix cir means orange-yellow and the suffix osis means condition. The dictionary definition of cirrhosis is a chronic disease of the liver marked by degeneration of cells, inflammation, and fibrous thickening of tissue. It is typically a result of alcoholism or hepatitis. Some of the causes are fatty liver that is associated with obesity and diabetes, blockage of the bile duct, meaning bile duct carries bile formed in the liver to the intestines, where it helps the digestion of fat. Viral infections of the liver, such as hepatitis B and C, and cystic fibrosis. Cystic fibrosis refers to the characteristic scarring of fibrosis and cyst formation within the pancreas. Some symptoms include loss of appetite, lack of energy or fatigue, weight loss or sudden weight gain, bruises, yellowing of skin or the whites of eyes, also known as jaundice, itchy skin, fluid retention or edema, and swelling in the ankles, legs, and abdomen. This is often an early sign. A few more symptoms are a brownish or orange tint to the urine, light-colored stools, confusion, disorientation, and personality changes, blood in stool, and fever. Stages and signs. Stage 1. The first stage of cirrhosis is characterized by the presence of inflammation and swelling in the liver, which causes destruction of liver tissues. Also, there might be growth of abnormal connective tissue. These two factors may cause problems in the area where blood and fluid flow in and out of the liver. Stage 2. In the second stage, fibrosis is beginning to occur. Due to the overgrowth of connective tissue that fibrosis causes, the scar tissue in the liver will lose its normal function as a liver tissue. This transformation of the scar tissue will result in permanent damage. In this image, you can see a healthy liver, liver with fibrosis, and cirrhosis liver. In the liver with fibrosis, you can see the excessive tissue that has built up all around the liver. In the cirrhosis liver, you can see the difference in color from a healthy liver and a cirrhosis liver. Stage 3. In this stage, the fibrosis forms bridges, which is called bridging fibrosis. These bridges connect veins and other vessels that cause abnormal blood flow and increases blood pressure in the liver. This increase of blood pressure is called hepatic hypertension. Stage 4. Stage 4 is the most advanced stage. Scar tissue progresses to the point that it is not functioning normally. Many symptoms in this stage include bleeding in digestive tract, jaundice, mental effects such as confusion, unusual sleepiness, and slurred speech, edema, and intense unexplainable itching on the skin. In this image, you can see the progression of liver damage. In the healthy liver stage, you can see a healthy liver is able to perform its normal functions effectively. For example, aiding digestion and breaking down harmful drugs and poisons. In the fibrotic liver stage, continuous inflammation of the liver caused by hepatitis C can lead to fibrosis, the formation of scar tissue within the liver. In cirrhotic liver, extensive scarring can block the flow of blood through the liver and cause liver function to deteriorate over time. This is called cirrhosis. In the liver cancer stage, hepatitis C is a leading cause of liver cancer, the formation of a malignant tumor in the liver. Diagnosis. The best test to diagnose cirrhosis is by a biopsy of the liver. Some patients with cirrhosis have enlarged livers or spleens. A doctor can palpate the lower edge of an enlarged liver, which can be found below the right rib cage. Some patients with cirrhosis, usually alcoholic cirrhosis, develop small red spider-like markings on the skin. These are most often found on the chest. A CT or CAT scan and ultrasound examinations can be used to evaluate the abdomen and liver. Treatment. In the early symptoms of cirrhosis, it can be possible to minimize the damage to the liver. People with cirrhosis caused by alcohol abuse should try to stop drinking. People with cirrhosis caused by non-alcoholic fatty liver disease may become healthier by losing weight and controlling blood sugar levels. Medications may control damage to liver cells caused by hepatitis B or C.